This is the story of the Worcester Medical Society. But before we start, I'd like to set the stage. In 1794, George Washington was 1 year into his second term. The U.S. Constitution was approved only narrowly in Massachusetts due to reservations about having too powerful a central government. More importantly, people in central and western Massachusetts had been unsuccessful in multiple attempts to prevent Boston from becoming the capital of the state. They felt that too much power would be concentrated in Boston and that the other towns would not get their fair share. In Boston, the Massachusetts Medical Society had been chartered by the state with the authority to certify physicians, but the society had limited its membership to only 70 doctors, and only one lived west of Framingham. The medical school in Cambridge had been in existence for 12 years, but only 10 doctors had graduated. Doctors in central Massachusetts felt excluded. They felt the need for a society that would set standards for education and practice and form a group where doctors could educate each other and better the profession. Thus, it comes as no surprise that 41 doctors gathered at U.S. Arms Hotel on Main Street in Worcester on December 18, 1794, to propose this new society. Worcester at that time only had a population of just over 2,000, but it was the center for the new county. It may also come as no surprise that one of the main instigators was Dr. Ebenezer Morse, one of the most educated men in the area, an aging physician, lawyer, and former minister, described as a man of strong passions, resolute, fixed in his purpose, and unyielding. He and his colleagues were not about to let those doctors in Boston exclude physicians around here. And so it began. Medicine in the 18th century was a far cry from what we know today. Most doctors trained through apprenticeships and did not attend medical school. Apprenticeships consisted of 4 years or so of assisting a practicing physician, but without any standardized curriculum. Medical schools taught by lecture, but students did not see patients. Medical practice was dominated by treatments such as bleeding, based on theories like imbalance of humors, not by science. Almost exactly 5 years after the founding of our society, even George Washington was a victim of this type of practice. For what was thought to be a bacterial throat infection, he was treated with enemas, blistering, purging, and was bled half of his blood volume by the best doctors in the country before he died while under their care.
Medicine in the 18th century was closer to religion than to science, more comfort care than cure. The idea that doctors needed to learn continuously by reading textbooks, presenting cases to each other, and certifying their qualifications was ahead of its time. Indeed, the Worcester Society recommended that doctors have a background in Latin, Greek, philosophy, and mathematics, and attend classes at the medical school in Cambridge if possible, in addition to an apprenticeship. Not all met the standard, but the ideal was held out there, some 90 years before a college degree was required for admission to Harvard Medical School.
Formal execution of this plan in central Massachusetts was not going to occur without a struggle. In order to certify doctors, the new medical society would need a charter from the Commonwealth, and the Massachusetts Medical Society was having none of that. A decade of lobbying and counter-lobbying ensued and was finally settled in 1804 that Worcester would become a district of the Massachusetts Medical Society and would have authority over all members west of Framingham. Perhaps the most important function of the new society was its library. After a false start in 1798, we had a librarian, but no books. A library was constituted in 1805 with a gift of 50 volumes from the Massachusetts Medical Society. In 1845, Mr. Daniel Waldo left $6,000 to the library. Other bequests followed. Through these and the efforts by Dr. John Green, the library grew to 2,400 volumes in 1858 and moved shortly thereafter to the new Worcester Public Library. itself established by Dr. Green. As a result, the library earned its reputation as one of the oldest and largest medical libraries in the country. The 19th century saw the society growing and medicine evolving. By 1878, there were 84 members. Meetings occurred 2 to 3 times per year and consisted of case reports, discussions, and an annual oration, usually focusing on an interesting problem. They were usually held over dinner at a local tavern. The need for education and certification became even greater as the scientific basis of medicine grew. At the same time, the community was being transformed. Worcester, with a population of just over 2,000 at the beginning of the century, grew to about 115,000 in 1900. Crowded conditions, infectious diseases, immigrants with diseases brought from foreign lands, and industry with its associated accidents provided challenges for the physicians. The population boom also led to the establishment of hospitals. The opening of Worcester State Hospital, referred to in those days as the Worcester Lunatic Asylum, heralded the beginning of more humane treatment of the mentally ill. This state hospital for the insane was the first of its kind in the country. In addition, Worcester City, St. Vincent's, Memorial, and Hahnemann hospitals all trace their origins to this era, as well as many others. In time, women physicians began to graduate from medical schools, and questions arose as to whether women should be admitted to the society.
In 1862, there were 4 women physicians listed in Worcester, as compared to 100 male physicians in the county. The Worcester Medical Society, after some debate, passed a resolution allowing the admission of women physicians in 1873. While this represented a delay, it was a full decade before a similar resolution was passed by the Massachusetts Medical Society. Then again, it took a little over 120 years before Worcester had a woman president.
The acceleration of scientific discovery in the 20th century brought better treatment of infections, advances in surgery, and advances in pregnancy and newborn care, where maternal mortality was cut by 99% and infant mortality by 95%. This pace of change meant that doctors needed to master more knowledge and skills, and to do so throughout their careers. The foundational values of the society, learning and improvement, became more critical. Meanwhile, the Women's Auxiliary of the Worcester District, later the Worcester District Alliance, was initiated in 1948. The alliance is comprised of physicians' spouses, and its focus is to promote the goals of the medical profession, meet community health needs, and provide support for the medical family. The alliance has awarded scholarships to nursing students, as well as adopting a number of cases to advance the public good, including CPR instruction and nutrition. Although the state established a Department of Public Health in 1869, the cause of public health was one that was never far from the heart of the Worcester District. In the early 1900s, concerns about children's health led the society to create a milk commission to assure a clean milk supply at a time when pasteurization was not generally adopted. Later, the society established a blood bank to provide this life-saving resource for both the community and the armed forces. In the early 1950s, the district collaborated with the U.S. Public Health Service to perform over 150,000 chest X-rays to screen for pulmonary and heart disease. And in the 1960s, a city-wide effort to administer the polio vaccine, led by the district society, resulted in the vaccination of tens of thousands of citizens. A charge of 25 cents per dose led to an unanticipated excess of $14,000. That provided the seed money to begin the district's scholarship program. A measles immunization program in the 1960s, supported by both the district and the state societies, led to a 97.6% reduction in reported cases of measles over 2 years. In 1969, led by pediatrician A. Jane Fitzpatrick, the society focused attention on the emerging problem of drug abuse. Members gave talks at local schools, and the Worcester Medical News featured an editorial on the dangers of prescription narcotics. The dramatic progress in medicine and medical education in the 20th century was followed by major changes in the organization of medicine and the delivery of care. Greater diagnostic and treatment capabilities led to the need for more systems and institutions. Hospitals, once little more than charitable institutions for housing the poor who were sick, became central to the delivery of sophisticated care. In addition to Worcester State Hospital for the care of the mentally ill, St. Vincent's, Memorial, Hahnemann, City Hospital, and many others grew during most of the 20th century to provide thousands of beds. Late in the 20th century, construction began on the University of Massachusetts Medical School in Worcester to help meet the need to educate more physicians.
Key dates in the history of the Worcester District was 1969. In that year, the construction began on UMass Medical School here in Worcester. In 1970, the school admitted its first class of 16 students, all men, using an auxiliary building we now call the Shaw Building. Then in the following year, 1971, we had a class of 24, 8 of whom were women, and the medical school was off and running.
But with the opening of the medical school, the society's charge to serve the educational needs of its members and to provide a library decreased. The provision of continuing medical education shifted from the society to the medical school and the local hospitals. The district decided to transfer its library to the medical school. Without a library on site, the society sold its building on Cedar Street and moved to its current location in Mechanics Hall in 1977. Healthcare improved over time and practice patterns changed to keep pace. Starting in the 1980s, inpatient care became less needed as care shifted to the ambulatory setting. Worcester, once home to nearly a dozen hospitals and thousands of inpatient beds, witnessed hospital mergers and closings and repurposings. We now have 2 hospital systems for general medical care and 2 more for rehabilitation or substance abuse treatment. The total number of general medical beds in the city now numbers just over 1,000. Even Worcester State Hospital, once having over 2,000 beds, closed as more and more psychiatric care moved to the outpatient arena. Physicians, once exclusively in small private practice, increasingly followed the approach pioneered by John Fallon, who, after joining his father in surgical practice in 1929, later added specialists to provide a broader service. Reflecting his training at the Mayo Clinic, the Fallon Clinic, now Reliant Medical Group, grew from its initial 4 doctors in the early 1950s, operating out of a house on Institute Road, to multiple locations in the county and over 500 doctors, nurses, and physician assistants. The medical school, once having a few academicians, merged with Memorial Hospital and other hospitals and now employs over 1,000 doctors. Private practitioners, even those in solo practice, have gathered into groups to better deliver care in the new environment. Other factors evolving in the late 20th and early 21st centuries influenced the priorities of the medical society. Concerns regarding cost and quality of care became paramount. Insurers and regulatory agencies started overseeing the practice of medicine. These changes added tremendously to the complexity of practice administration, but no durable solutions to the cost and quality issues have emerged. The society met these changes by educating its members regarding the growing regulations and representing the values of the medical profession to the government, hospitals, and insurers. Here, the partnership of the Massachusetts Medical Society and its resources in legislation and health policy became invaluable. The story began with a Dr. Morse, and as we approach the present, another Dr. Morse emerges. Dr. Leonard Morse spent much of the last 60 years practicing medicine and public health in Worcester, but also in laboring in nearly every corner of organized medicine. When doctors in private practice felt threatened by the corporate takeover of medical practice, he formed them into a group to stand up for their principles. When, as head of the state's medical licensing board, the politicians in Boston imposed a rule that doctors who did not participate in the government insurance plan would be denied a license to practice, even though they were qualified, he resigned rather than enforce the rule. Resolute, fixed in his purpose, unyielding. Sound familiar? Some things in Worcester don't change. And yet we too have evolved with the times. Once limited to 2 or 3 meetings per year over dinner, the Worcester District now has 19 committees, holds educational sessions, produces the Health Matters TV show, publishes the Worcester Medical Journal, and has awarded hundreds of scholarships to medical students as well as numerous other activities. Our membership is just now under 2,500, and we reflect the makeup of both the profession and the community. Although science and technology have accomplished miracles, human relationships remain at the core of healing. The values that brought us together in 1794 remain. That medicine is a profession that is enriched when its members gather together to do more as a group, to better themselves as professionals, to hold true to our ideals, and to better the practice of medicine. And so it continues.